This is something that's come up in practice a couple of times recently, so I thought there might be interest out there in the general public knowing about this issue that can sometimes come up when folks have IUDs implanted. IUDs that can be either hormone secreting or non-hormone secreting, and the issues that I've seen have typically been around hormone secreting IUDs. Now, the vast majority of patients who have hormone secreting IUDs implanted, to my knowledge, have no significant issues with them. I think they're fantastic for a lot of patients. But I've had a number of patients over the years where they have a hormone secreting IUD that's implanted and the patient develops symptoms as a result from that. They have the device implanted, and within days, weeks, maybe a couple of months, they start developing some symptoms. Sometimes it's been migraines, sometimes it's been abdominal pain, sometimes it's been different neurological symptoms, sometimes it's feeling really, really tired, sometimes it's people feeling dizzy, sometimes it's all of the above. And again, this is quite rare in the general populace, to my knowledge, but when the patients are having these issues, on the one hand, you might think, well, maybe they should just get that removed and problem solved. And sometimes patients do that and they're able to do that. But in some cases, the hormone secreting IUD is really helping them. It's helping to keep their super, super heavy menstrual flow under control, or it's helping to address certain symptoms, maybe that were associated with endometriosis or different things like that. And so the patient's like, well, I'm having these side effects, and I'm also getting the benefits. I don't want to give up, throw the baby out with the bathwater, so to speak. And so in those patients, when they're kind of stuck between a bit of a rock and a hard place, then one thing that I found to be very helpful is low-dose immunotherapy. Typically, it's a progesterone secreting IUD, and that when we use progesterone low-dose immunotherapy, it can be really, really helpful. I've seen it significantly reduce symptoms that are caused by the hormone secreting IUD, or in some cases completely resolve those symptoms. Somewhat ironically, even though these progesterone secreting IUDs are secreting progesterone, sometimes it's actually estrogen LDI that we need to work with, and that is likely because as there's more progesterone that the body is being exposed to, then there might be this compensatory increase in estrogen that the body is creating to try to balance out that progesterone, but ultimately the progesterone wins out. But that even relative increase in estrogen might be enough to tip the scales if there's an estrogen sensitivity going on in the first place, which is a semi-regular thing that I've seen with patients who are dealing with chronic sex hormone related concerns, especially when it's around menstrual related parameters. So just a little tidbit there, if there are symptoms that come on after the administration of a hormone secreting IUD, then and if one is kind of quote unquote stuck with the IUD because of the benefits that it's conferring, there are potential ways to help mitigate some of those symptoms. Good old low-dose immunotherapy, one of my favorite therapies of all time. I hope this information was useful. If you have any questions about this topic or anything else, just post in the comment section below, and I will leave it there for now.